namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. So glad you're joining us today. And if you have not done so yet, then please go to hotzepodcast.com. That's HOTZE podcast.com to download all of our podcasts. So much interesting information out there. And we have a really great show for you today. It is on a vitamin that a lot of people hear that they need to take. Not sure exactly what all the benefits are. So surely interested in having Dr. Hotze enlighten us on the benefits of CoQ10. Dr. Hotze.
Thanks so much, Stacy. You can see she's wired up. She must be taking her thyroid.
That's right.
I think so. She's on top of it. She is the most enthusiastic woman I've ever met in my life. She's full of enthusiasm every day, particularly on the radio program. And I just try to draw a little bit of her energy. And we're going to talk about energy today. But just she's got that, she's got bundle of energy and enthusiasm. So it's always a pleasure.
Thank you, Dr. Hotze.
Be on the podcast with you and on the radio and on TV, wherever I can be. I love to be there because you give me encouragement, give me enthusiasm. Okay, we're going to talk today about giving your heart enthusiasm. Have you ever asked yourself, is my heart enthusiastic? You know, we talk about the heart in a lot of ways. You know, do you have a heart for your spouse or your kids? Do you have a heart for this work? Do you have a heart for the people that are less fortunate? People talk about heart. I give you my heart, as a lover, one lover would say to another. I love you with all my heart. So the heart is historically known as the seed or the seat of all emotions arise in the heart. We know it really comes from the brain, but we call it our heart. And sometimes, you know, I'm sure you and I have, and other people, most everybody's experienced a broken heart at one time or another in their life, either from loss of a lover or breakup with a lover or loss of a loved one, a family member. And I can remember how it feels. It hurts in your heart.
It does.
It hurts right here. It doesn't hurt in your brain, but it hurts in your heart. So the heart's very central in our language as far as our overall emotional health and well-being goes. And we want to have a heart that's happy, a happy heart, and we want to have a heart that's healthy. So today we're going to talk about how you can have a healthy heart, and we're going to talk about one really critical molecule or nutrient, and that's coenzyme Q10, which is also known as ubiquinone, and it's a fat-soluble antioxidant that is very critical for energy production within your cells. You've heard me talk about the source of energy in our bodies lies within the cells in power plants called the mitochondria. Every cell in your body, you got 70 trillion cells, plus or minus a few trillion. You've got all these trillions of cells in your body, and every cell has at least one mitochondria or power plant in it. Some cells that need to be high energy producers, like the heart cells, have thousands of mitochondria. And so the mitochondria or the power plants receive the nutrients from the food we eat, are energized by the various vitamins and minerals as well as the hormones. And exercise, too, stimulates mitochondrial function. But all of these enable the mitochondria to produce energy. And individuals that have good energy production within their mitochondria are high voltage individuals. The energy you produce in your body is electricity. You're producing electricity. And the particular molecule that carries the electrical current or the electron is the ATP adenosine triphosphate, which you may remember from biochemistry or from biology. And in order to make the energy molecule, the currency of the cell, the way energy is transported from the power plant to the other metabolic processes in the cell, is transported via the ATP molecule. That's the currency of the cell that carries the energy. Well, in order for that mitochondria to be able to produce that adenosine triphosphate, that ATP energy molecule, it's got to have coenzyme Q10. It is a cofactor, a coenzyme in the production of the energy molecule within the cell. So it's very, very important for overall health, particularly for cardiovascular health, because the heart, each cell contains thousands of mitochondria, power plants. So you got to have a lot of coenzyme Q10 for your heart. It's so critical for the heart. Now, coenzyme Q10, as we age, declines, just like most other things in our body begin to decline. It's the aging process. Our hormones go down. Coenzyme Q10 levels, coenzyme Q10 levels also begin to fall. So not only is the coenzyme Q10 important for cardiovascular function, but all the cells in the body have these power plants, and they all need coenzyme Q10. So as our coenzyme Q10 levels go down, people begin to experience health problems. Coenzyme Q10 is particularly important for the heart. Not only does it enable the heart cells to produce energy, it also is an anti-inflammatory. It cuts down on the inflammatory molecules that are in our circulatory system, particularly in the heart, and it quells those. It is an anti-inflammatory to quell inflammation in the heart and other inflammatory markers. We test here at the Hotze Health and Wellness Center for C-reactive protein and homocysteine, and those are inflammatory markers, and when they're elevated, that indicates you have inflammation in your body. And coenzyme Q10 helps decrease that inflammation. So it's important for your cardiovascular function to be sure that you have adequate levels of coenzyme Q10. Now, I want to tell you how powerful coenzyme Q10 is, particularly in congestive heart failure. Congestive heart failure is when the heart muscle, because of poor blood flow or decreased blood flow or due to injury from a heart attack where you have damaged heart cells, or from several other, it could be inflammatory process going on, it could be an infectious process going on, it could be a congenital problem, but the heart gets large and flabby, and so it doesn't work well, and when it contracts, it doesn't create the blood flow necessary to keep all the organs functioning well, and things begin to back up. So people that get congestive heart failure get swollen legs, they get edema and swelling in their ankles, their feet, and their legs, and they get dyspnea, shortness of breath when they lie down. So they have to sleep up oftentimes on pillows, not pillows, pillows. So, and when they walk across the room, they get short of breath. That's exertional dyspnea. And this is caused by congestive heart failure. Well, what they find is when they do blood levels of coenzyme Q10, they find that people with congestive heart failure have very low levels of coenzyme Q10. Now, I'll tell you an interesting story. I had a young guest of ours came in, and he was in his mid-20s, and he had congestive heart failure. He had cardiomegaly, which is an enlarged heart. And the doctors had searched everywhere. He had no reason for it. They thought, well, I guess it's just genetic. And he was seen by a doctor down in the medical center here in Houston. And the doctor was the head of the transplant program for hearts at one of the major medical schools in Houston. And he told him, well, this is what we're going to try to do first. And he put him on some Corgord and some other medication, quite a bit of medication, lower blood pressure. He didn't have low blood pressure. His blood pressure was low anyway because he had congestive heart failure. And he tried him on that, and then they put a pacemaker in, and they wanted to see if that works. And he says, well, the next step, if that doesn't work, well, we're going to do a heart transplant. Well, that's what he's in the business of doing, is transplanting hearts. So once you get in that queue, so to speak, you're pretty much going to end up with a heart transplant because the drugs they were using and the pacemaker are not going to stop further aggravation of his congestive heart failure. So he happened to be feeling low and kind of depressed, his energy levels down, he's not producing enough, he's not circulating enough blood to keep him alert. So he So the doctor says, why don't you go see a psychiatrist? So he goes to see the psychiatrist.
Oh, my goodness.
Now, this is very interesting. The psychiatrist did a very extensive blood test and even measured the coenzyme Q10 level, which his own cardiologist had never done. And we don't routinely do that here at the Hotze Health and Wellness Center unless somebody was in really bad shape. Not routinely, you don't check the coenzyme Q10 level. But the psychiatrist did, and it was at the bare lowest it could possibly be. I mean, it was at the bottom of the barrel. Well, coenzyme Q10 is used in Japan for treatment of congestive heart failure. It is the treatment of choice in Japan. That's where it was first developed, discovered, and invented. And by the way, the coenzyme Q10, as I said, is primarily made by the liver when you're younger, but as you age, the levels continue to decline. So in Japan, when people have congestive heart failure, they give them coenzyme Q10. So this isn't our normal patient. You know, this guest isn't our normal type of guest that we see, a young boy with or a young man with congestive heart failure. You see it in older individuals that have had heart attacks and high blood pressure and diabetes. You can see that in older individuals, 60s and 70s, but you don't routinely see it in a young man for no known cause. But he has low coenzyme Q10 levels. So I thought to myself, he had come from the cardiologist, and he'd been seeing, and he had been going down, continuing to go downhill on his medications, and his mother had encouraged him to come here. And so I looked at him and I thought to myself, you know what? Let's try to help this young man, because the path he's going down right now is not helping him. So I did some further review on coenzyme Q10, and I studied a doctor by the name of Dr. Stephen Sinatra, who's a cardiologist that has had fabulous success using coenzyme Q10 in his patients. And he uses large doses, 400 to 600 milligrams per day with his patients. He treats them until they start to get symptomatically, they improve. And so I started this young man on high doses of coenzyme Q10. He also, except that he's thin, he has all the signs and symptoms of low thyroid. And it turns out in some instances, hypothyroidism can lead to congestive heart failure. And his TSH level was very high, which is inversely related to thyroid hormone. And so that indicated that he may also have hypothyroidism. Now, I've only been seeing this young man for about 2 months, but I know this, that if we have half the success that Dr. Sinatra's had, and the success that the Japanese physicians have when they treat heart disease, this young man is going to be healthy. And it may take 3 to 6 months to begin to develop energy within the heart, but the coenzyme Q10 is what's the critical factor that enables your power plant, your mitochondria, to produce ATP, the energy molecule. And without it, you can't produce it. So you can imagine the heart, which is beating 72 times a minute, 100,000 times a day, requires a huge amount of energy. And if you don't have that essential cofactor, which is coenzyme Q10, available, the heart's not going to run well and do well. So now that leads us into another area of problem among individuals that see your conventional cardiologist or doctor, and that's the use of statin drugs that lower cholesterol. Cholesterol is made in the liver. And cholesterol its production, the enzyme that produces cholesterol in the liver, is blocked by a statin drug. Simultaneously, the statin drug also interferes with the production of coenzyme Q10 in the liver. So when a person's on statin drugs, their coenzyme Q10 levels plummet. Well, guess what happens? They end up getting heart disease. So people on statin drugs over time, because of poor levels of coenzyme Q10 being made in their bodies, are now having energy problem development in the heart. And I think one of the reasons we see the rise in congestive heart failure today is because people take coenzyme Q10. And you know my take on cholesterol and on the statin drugs, they are poisons. They have to poison the enzyme system to make cholesterol, what your body needs for a good health. Cholesterol is not bad for you. It's essential for life. And we know this, that individuals that take statin drugs oftentimes have a host of health problems. I've had so many people tell me, as soon as I got on those statin drugs, I felt tired all the time. My muscles ached. I couldn't think clearly. People get global amnesia because it sucks the cholesterol out of your brain. Every cell in your body has a lipid ring around it with cholesterol, and it's essential for good, healthy function. And as you suck out that cholesterol, the body doesn't function as well. The cells don't function as well. The brain doesn't function as well. So I'm not an advocate of statin drugs. As a matter of fact, anybody I can convince, I do. I always tell them, just stop your statin drugs. Your problem with the coronary artery disease is not caused by statin drugs. It's caused by inflammation. It's not caused by cholesterol. It's caused by inflammation. So cholesterol is the Band-Aid, so to speak, that patches an inflamed artery if you don't have enough vitamin C to make collagen. Then the backup mechanism is cholesterol. So cholesterol is a sign that you have cholesterol plaques in the arteries, or a sign you have inflammation. You got to get rid of the inflammation, and you can do that very simply taking good, healthy doses of antioxidants, particularly vitamin C and vitamin D are very important in that, as well as L-lysine and L-proline, which are two amino acids. So the statin drugs poison coenzyme Q10. If you're on statin drugs, you absolutely should be on 300 to 400 milligrams of coenzyme Q10 every day, because you're not making. And who takes statin drugs? People over 40 normally. You don't give it to young people routinely. So and that's when we see our own production of coenzyme Q10 decline naturally. Now we're going to block it with a statin drug. You've got to take it. And why? I don't know. Cardiologist, why don't you tell your patients about the dangers of statin drug and what it does to poison the production of coenzyme Q10? You need to tell them that, and you need to put them on minimally 300 to 400 milligrams of coenzyme Q10 every day. I mentioned to you in coronary artery disease, coenzyme Q10 is also an anti-inflammatory, and it blocks the inflammation, like cytokines and other pro-inflammatory molecules that are floating in the system. So it helps in coronary artery disease. It helps lower blood pressure. It helps lower cholesterol. So coenzyme Q10 serves numerous key functions, and it will keep your heart healthy. I take myself somewhere in the neighborhood of 300 to 400 milligrams of coenzyme Q10 every day and a half years. I learned about coenzyme Q10 when my dad had his heart problems, and he discovered it reading a newsletter back in 1990, after he had his medical catastrophe when they tore open his artery when he had his angioplasty. So it had emergency surgery and damaged his heart, and so he had congestive heart failure, and he learned about coenzyme Q10. He said, son, I want you to read about this. I read about it. I said, how come I wasn't taught about that? I wasn't. And that goes all the way back to 1990. And we still have physicians that don't know anything about coenzyme Q10 to this day. And they give them this poisonous drugs like the statin drugs, and they don't provide them with the coenzyme Q10 their body is now unable to make. So if you want to have a good, healthy heart, you want to make sure your heart produces good levels of energy. In order for your power plants within the cells of your heart, and there are thousands of them, in order for them to produce good levels of energy, you need to have good levels of coenzyme Q10. So I highly recommend, if you're not taking coenzyme Q10, I would highly recommend you taking it as a preventive measure to help you keep your heart healthy.
And Dr. Hotze, would you say that you said at 40? So if they don't have any history of heart issues, you would recommend 40 would be the age, or
I would recommend
how old?
Well, minimally at 40. Sure, I mean so we know it declines by the time you get to 40s when you see the decline occur. So it's not going to hurt you to take coenzyme Q10. You're not going to overdose on coenzyme Q10. So if you're younger, you might take 100 milligrams a day. It helps with your overall energy production and the whole body. It helps you think better.
It's a great point.
I mean, it helps. If you can do anything to help the mitochondria produce more energy, you want to do that. So eat healthy, replenish your hormones when they begin to decline and become imbalanced. Take your vitamins and minerals or nutrients that are essential for the production of energy within your mitochondria, within the power plants. And coenzyme Q10 is one very important nutrient that I'd recommend taking.
Really good advice, Dr. Hotze, and it is a mindset. So many of us grew up just listening to the doctors, not thinking any differently. The answers are there. There are natural approaches to getting your life back, and it's so easy to get on CoQ10. All you have to do is go to HotzeVitamins.com. That's HotzeVitamins.com, or call 1-800-579-6545. You can talk to one of our vitamin consultants. They'll be more than happy to serve you. That's 1-800-579-6545. Dr. Hotze, thank you for such important, life-changing information like CoQ10. Everybody should know about it. So thank you for joining us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.